So this is a 27-year-old male who came to the ER with a history of RTA and fracture dislocation of the spine with ACIA neurology, as you can see here. And I took the patient immediately to the theater, and this was what was done. I reduced the fracture after efforts, and I did a long segment instrumentation, and this is how I felt immediately after the surgery when I came out. So as a spine surgeon, reducing a 2-level spondyloptosis. The same patient came to me at the end of 1.5 years, divorced, and he was under severe depression on medications. And the moment he saw me, this is what he stated: "Why did you save me? You could have let me die." And this is how I felt again as a surgeon and as a doctor when he stated this sentence to me, and I didn't have any words to console him. And even our Superman is not an exception to this. As you all know, he's a quadriplegic because of fall from his horse at the age of around 50. So myself, I am Dr. Sudhir Ganesan from Chennai, and I am going to present my paper on tapping the role of Wnt signaling for neural regeneration in spinal cord injury, a novel therapeutic approach. So this is my disclosure, and this research work was done using the AO Spine Startup Research Grant Award. The reported incidence of spinal cord injury ranges between 12 to 60 cases per million inhabitants, and most of it affects the male, especially in their productive age group. And studies have shown that the suicide rate in these patients is about 5 times more than the population, general population, and half of them suffered from anxiety, stress, or post-traumatic stress disorder. We all know it is not only the patient but also the caregivers who are the victims of spinal cord injury, and according to this paper, the annual healthcare expenses approximates to about $185,000, and spinal cord injury has major implications and negative consequences, including physical pain, anxiety, sorrow, etc. in these patients. And we all know that spinal cord injury is there are two mechanisms. One is the primary hit mechanism, and the second one is the secondary hit phenomenon. The primary hit mechanism takes place at the time of injury, and we do not have any control over that, whereas the secondary hit mechanism is because of the various pathologic mechanisms which happens at the region of injury. And one of the most important thing is the formation of the glial scar by the reactive astrocytes, which is a preventive mechanism as such, but that actually prevents neural regeneration and proliferation. There are n number of studies and n number of molecules which has been studied in literature to counteract this, but none of it has been proven to be efficacious. So the Wnt family is a family of glycoproteins of 19 ligands and 10 receptors, and they play a very vital role in cell signal modulation, and they act via 2 pathways, which is called as canonical, and the other one is non-canonical pathway, of which the Wnt3A, 5A and its inhibitors SFRP2 and 4 and the canonical signaling pathway has been studied extensively in literature in various pathologies. So the Wnt3A is expressed in the dorsal midline region, and it is responsible for the developing spinal cord, and it participates in self-renewal, proliferation and differentiation and motility of the neural cells during development. According to this study in rats, there is an increased regulation of the Wnt ligands immediately after the spinal cord injury. However, it comes down at the end of 7 days. Similarly, there is an increased upregulation of the Wnt inhibitors immediately after the spinal cord injury as well. So with this background, we aimed to identify the role of Wnt signaling in neural proliferation in PC12 cell lines, and to identify the antagonists to Wnt signaling critical to modulate neural proliferation, regeneration and differentiation, to develop a proneural and an antiglial cellular pathway. So this study was conducted in the Spine Innovate lab at our university, and we acquired the PC12 neuronal cell lines and SVGP12 glial cell lines from NCCS Pune. The cells were cultured in RPMI 1640 medium using 10% horse serum, 5% FBS and 5% CO2, and all the cells were treated with 5 mg per ml LPS for 12 hours to simulate the injured neuronal cells. We then analyzed the effects of Wnt3A, 5A, SFRP2, SFRP4 and the combined effect of Wnt's and SFRPs in the neuronal cell proliferation and the glial cell proliferation. All the cells were then subjected to the Alamar Blue assay, and the readings were then recorded using the spectrophotometer. Coming to the results, we found that Wnt3A and Wnt3A 5A actually increased the neural proliferation, whereas SFRP2 and SFRP4 reduced neuronal cell proliferation. We wanted to know whether SFRPs actually resulted in neuronal cell death. Hence, we subjected these cells to acridine orange and propionum iodide staining, and we found that SFRP2 and SFRP4 actually resulted in neuronal cell death. And we also wanted to study the effects of SFRP2 and 4 on Wnt3A and vice versa using Western blot, and we found that SFRP2 and 4 actually had negative effects on Wnt3A and vice versa compared with the control. So when we added SFRPs along with Wnt3A and 5A in the neural cell lines, we found that there was a decrease in the neuronal cell proliferation when we added SFRPs. When we studied the effects of Wnt on glial proliferation, we found that Wnt3A and 5A actually reduced the proliferation of the glial cells, whereas SFRP2 and 4 increased glial cell proliferation, and when SFRPs were added to Wnt, there was a slight increase in glial cell proliferation. Finally, we also analyzed the effects of Wnt in the neuronal cell migration, which is very crucial for neural regeneration, and we found that Wnt3A actually increased neuronal cell migration, whereas SFRP4 reduced neuronal cell migration. So to summarize, whenever there is a spinal cord injury, there is an upregulation of the Wnt ligands, which results in neural regeneration and inhibition of the glial cell lines, whereas SFRP4 has a negative feedback mechanism to this. Hence, by adding Wnt ligands and SFRP inhibitors to this can actually increase neural regeneration and reduce the glial cell proliferation. According to this article, Wnt3A improves functional recovery through autophagy activation by inhibiting the mTOR signaling pathway, and it actually inhibited the neuronal apoptosis, promoted the regeneration of axons and recovery of the motor nerve function. This is an article in 2019 which stated that Wnt3A provided a favorable microenvironment for the recovery of nerve function in spinal cord injury. However, very few studies have focused on the effect of Wnt3A in spinal cord, and its specific mechanism has not been fully elucidated. This is one of the latest articles which studied the role of SFRPs in spinal cord injury, and they stated that actually SFRP4 promoted apoptosis of the neuronal cell lines, and its knockdown led to the activation of the catenin pathway, resulting in functional recovery following spinal cord injury. Now, why we chose Wnt as a therapeutic target? We all know that in spite of good fertilizer, good seeds and good source of water, the soil or the microenvironment matters a lot for a good harvest. So even if you are going to pump the spinal cord injured side with good neurogenic growth factors or stem cells, if the microenvironment is not good, then it is not going to help. So our study is the first study to analyze the role of Wnt agonists, SFRPs, and the combined effects of Wnt agonists and SFRPs in both neurons and glial cell lines. So we have finished our study in neuronal cell lines, and we are awaiting ethical approval for animal study. After that, we'll be going on for human trials with the ultimate aim of seeing a spinal cord injured patient mobilizing. And our review work on the same has been published in this molecular neurobiology recently. So to conclude, Wnt ligands results in neural proliferation and glial inhibition. SFRP4 has negative effects, and a spatiotemporal characterization needs to be studied in detail. Nandri.